Welcome to this special broadcast. I'm Tamanna Inamdar. Today on the 1st of May, India has started its phase 3 of vaccination, which essentially means that all adults are eligible for the vaccine from today. It's important that this eligibility has come forth because on this day, India has also crossed over 4 lakh cases of COVID-19 in the last 24 hours. And an aggressive vaccination drive will hopefully push us towards the end of the second wave of the coronavirus pandemic. But let's talk a little bit about what is happening in this vaccine drive. Everyone can now get a vaccine, but where are the vaccines? So as of last evening, most states said they would not be able to start the vaccination drive at all from the 1st of May because they've simply not received their vaccines from the two companies that manufacture them, Serum Institute of India and Bharat Biotech. But by later last night and this morning, some piecemeal efforts have begun. One could call it a bit of tokenism, but at least on paper, the drive has begun in limited districts and places. So, for example, in Maharashtra, the drive has begun in just a few districts. In Uttar Pradesh, 7 districts will be covered from today. And in other places in the country as well, there are some people who are getting their vaccinations between the ages of 18 to 44. These are extremely limited numbers, though. We took a look at the COVID app, the COVID portal, just a few minutes before this show began to check if there are any slots available. And in most places, in most large cities that we looked at, there are no slots available at least for the next 7 days. So it's going to be a hunt for the vaccine over the next few days and weeks. Remember, all centers are saying they will only accept those with registrations on the COVID portal. No walk-ins will be allowed or entertained. Meanwhile, in the midst of this, there are two kinds of vaccination drives going on for those between 18 to 44. One is what the state governments are doing, where they are saying that vaccines will be for free. And 3 private hospital chains so far have announced that they are also beginning their vaccination drive. This is Apollo, Max Healthcare and Fortis. The vaccines are ranged between prices of 800 to 1250 rupees, depending on whether it's Covaxin or Covishield. These also have begun with very limited stocks. We need this trickle to turn into a flood. How do we do that? And how soon before we can get a significant number of people actually vaccinated? To speak on this today, I have a very special panel. But before I go to the discussion, I want to play out for you ground reports from across the country. I am right now outside one of the vaccination centers, that is Max Hospital, Panchsheel Park, and you can see people in large numbers have in fact reached here to get themselves vaccinated. And we have seen how in the COVID portal also there are 3 park sites of Max Hospital, Panchsheel Park, and all of them are in fact, the slots are in fact all filled up for the next 3 days. Apart from Max Hospital, Fortis, Shalimar Bagh, Okhla, the NCR region Fortis is also giving vaccination to the people. Apart from that, Apollo Hospital is also giving vaccination to the people who are between the age of 18 and 44. So this is what is happening right outside Max Hospital, Panchsheel Park, and you can see how people are in fact lining up in queue to get themselves vaccinated.
We are here at City Colony CHC. This is a very important COVID vaccination center related to SMS Medical College. But here you can see that vaccination center is not being opened up. What officials are telling us that they have not got vaccine to vaccinate 18 plus people who have registered on various COVID app and Arogya Setu. What officials are telling us that by 11 a.m. flight they are expecting a consignment of vaccination from Pune, and after that from 12 p.m. they are expecting that they would be able to start vaccination of 18 plus people in Jaipur.
Vaccination center, which was earlier set up, was dismantled, and they said this would be the new center. The earlier center as well, the gates are closed, and this particular center you can see a huge queue of people standing, hoping that they get their jab, but it seems like no intimation here, no information to the patients other than the security guard who's telling them that he has no clue. Let's speak to some of them over here. How long How has it been since you came?
It's about 15-20 minutes that we have been waiting. There is no information whether it's going to happen today, and the security guard also has no information. So we are at loss to see whether here to vaccinate us. So we are patiently waiting. Hopefully they will come.
Here in Patna, which is where there is a vaccination center, we'll talk to the doctor here and try to know from them as to whether those above the age of 18 are being administered the vaccination or not. Ma'am, a second. Now it's being said that the third phase has started today. Do you have sufficient vaccines for those above the age of 18? Are they being given vaccines today?
No, in Patna we are not having. We are going not for the 18 to 45 years of age. Right now, what we are giving for is 45 plus, and healthcare workers only, and frontline workers. For healthcare workers and frontline workers, it's 18 to 45.
Ashutosh Raghuvanshi, CEO and MD Fortis Healthcare, on the show with us today. Dr. NK Arora, Chair, COVID Sub-Committee of NTAGI, speaking with us. Dr. Giridhar Babu, Head Life Course Epidemiology, PHFI, on the show. And Dr. Rajib Dasgupta of the National AEFI Committee, also with us. Welcome to the show, and thank you to all of you for taking out the time to speak with us. Ashutosh Raghuvanshi, let me begin by getting a sense from you, because you're one of the few private hospitals who have managed to bag doses and have started the vaccination program today. How widespread is it, in how many centers, and how many people between 18 to 44 can you vaccinate per day?
So we have got very limited supply available. We have absolutely no visibility as to when the supply from Serum Institute would be available. We managed to get 50,000 doses of Bharat Biotech vaccine, which we will be administering at about 6 of our centers over the period of, say, my belief is that this would be sufficient barely for a week or so. We expect that during this time we would get clarity on the availability of other vaccine, and some sense will prevail as far as the distribution of the vaccines is concerned.
Mr. Raghuvanshi, why is there no visibility on the availability of vaccines? I mean, in general, people know that there's more demand than supply, very simply put. But when you're speaking to these vaccine makers, when, from the 19th of April, there has been a system put in place that 50% will go to state governments and private sector. And this is a story from everywhere. What are they saying to you when you ask, okay, at least tell me, by when will I get my order?
Honestly, they are simply saying that they cannot give us a timeline. They say that they themselves have no clarity. A 30,000 feet kind of an order or a desire that 50% should go here, this much should go there, has been created. There is no system which at least we are aware of, that this is how the distribution will happen. Whether it should be a transparent system. I'm not aware how the Serum Institute vaccines have been distributed so far to the private sector, if any, and that is a cause of concern. So what we believe is that it is important that the government takes some kind of an ownership of creating a clearly defined supply chain. And there should be a kind of a very defined and transparent mechanisms as to how the allocation of vaccines is done to various states or any other geographies or entities. That is, I think, what is of core importance. Because if everybody has to be given vaccine, we have complicated the whole thing, but the people have to register, then there are no slots to be found. Why can't there simply be a system of walking in and getting the vaccine and then getting counted? Many other vaccination drives have been done in this country. Those have been done without any apps. So I think, there is a very nice scheme on paper, but the fine print, no one knows.
You made a very important point about, is the online portal really the best way to make sure that everyone is included? Let me go across to Dr. Giridhar Babu on this. So 2 points on this. The reason ostensibly for having only registered people eligible for walking in and getting the vaccine is to avoid crowds, because you don't want people lining up in large numbers and create the vaccine drive into a super spreader event. But on the other hand, don't you run the risk of cutting out people who may not have access or the know-how to register themselves? A large section of our society may not just be able to do this.
Yeah, Tamanna. So let me explain the way I have understood it, because again, as Dr. Ashutosh clearly mentioned, I'm not aware of the complete details. I think the government of India has prioritized giving vaccination to 45 years and above. Therefore, you can see that more centers are available for those who have 45 years and above, and it continues to be unhampered. Two, there is definitely supply constraints, and therefore there is this provision of allowing the vaccination sessions for 18 years and above a little later, not right now. Some states have announced clearly that till 15th of May, they should not come. They will inform the participants when to come. So I think it's more of a communication issue, which has to be better both at the central level and also at the state level. Third, coming back to your point, I completely agree with you. Not everybody can register on the CoWIN app. Unless somebody helps them, most people cannot, even in urban areas. Therefore, there has to be an offline version which can be uploaded later on into the CoWIN app. I have been noting this from the beginning. We have done tremendous progress with polio eradication and other programs without any app. Doesn't mean that there is no need for app. I like apps, but that should not be a barrier for speed and wider coverage. So while I like the data to be uploaded to the CoWIN server, offline option, outreach sessions, and the way we do other measles and rubella by planning in outreach session, we should plan extensively. But for all of this, Tamanna, there are not enough vaccines available right now. Therefore, my appeal, at least through your channel, is that let's prepare better micro plans and mobilization campaigns. As soon as the vaccines are available, let's go at a pace where we will be able to prevent any kind of casualties in the third wave.
We'll have to wait for the vaccines to come. I mean, a lot of people watching right now must be thinking, when will my turn, come for the vaccine? Clearly, it's going to take some time if you're between 18 to 44. In fact, in some cases, the 45 plus drive is also getting hampered because of a paucity of vaccines. Dr. Rajib Dasgupta, it's great to speak to you on the show, and I have a slightly different question for you. Of course, the biggest question right now is, when will this drive actually kick off? 1st May seems more like a token beginning. But my question is about the efficacy in terms of new variants. And I'm basing this, I must say, not on any data because none is available, but on anecdotal evidence and what people are saying. The people after 1 dose, sometimes people after 2 doses of the vaccine are also becoming seriously ill. Is there a concern? Are we trying to find out if new mutations of the virus are able to beat the vaccines as well and escape immunity?
There are 2 or 3 related points here. One, that these vaccines in the adults do not offer the kind of 100% protection we are used to in the childhood immunization. So many who would have received even 2 doses of the vaccine will get an infection, may get an infection, which will almost certainly be of a much milder variety. But this doesn't mean that immune escape or that susceptibility to other variants is not possible. That's also a reality. The question is that what has been the role of variants, and therefore how do we build in the issue of variants? And that quite clearly is the 2 variants. The UK variant initially did play a very significant role in the phase in Punjab, February, March, and the B1617 or the Indian variant, or under quotes the double mutant, which is not a term to be encouraged, played a very significant role in Maharashtra again during February, March. This is relevant because till the end of March, these two states accounted for 75% of the new cases, which means they were really driving the rising phase of India's second wave, particularly through March. And what we see in Delhi today is probably multiple mutants at work, multiple mutants from within these. Now, why this is important is that these mutant forms are highly transmissible. They are, though not necessarily more fatal on a unit population basis, but it actually means that it leads to an explosion of cases, and that's what is overwhelming the system. And therefore, what Dr. Raghuvanshi was alluding to, that we are not able to vaccinate younger populations, which is certainly far more, relatively speaking, getting infected in this phase, and which is also an expected trend. So therefore, it is those populations, particularly the working population, who we won't be able to protect, at least in a time scale that we would like to. Now, the short point is that all these are extremely complexly intertwined and makes both the problem and the solution far more complex than it may seem.
Dr. Arora, what is the time frame looking like? I know this is a difficult question because if the vaccine manufacturers are saying they can't give state governments visibility, then what do we do? But we do know how much they make, which is about 80 to 90 million doses a month. As of May 1st, they're hoping to ramp it up. We're not sure when the Sputnik will start getting delivered. But at this pace and at this rate, how much time before we hit herd immunity? Some calculations are another 22 months.
So, Tamanna, thank you very much. You're raising very, very important questions. And these have to be seen in the context of realism. There is no doubt that vaccine is available only in limited amounts. And by all scientific and whatever evidence, even in this current upsurge is available, the health system is getting overwhelmed by people who are above 45. They are getting more serious illness. The fatalities are also more. So the proportion of people, maybe the younger people are getting more infected and symptomatic, but still the people who are seeking hospitalization proportionately remains high in those above 45 years. And so that is why the national effort to see that those who are above 45 continue to remain a priority with the central government. And as we know, about 15 or 16 crores have been immunized, mostly one dose only, few 2.5 or 3 crores is now second dose. And total number required above 45 is 40 crores. So that itself requires about 800 million doses or 80 crore doses. Now, the current capacity of manufacturers is, I think I was just seeing it was around 8 crores per month for the country. And therefore, we need to very clearly see that the focus, the focus and priority for 18 to 45 will remain at lower level as compared to those above 45. Now, Ashutosh's point and a very important question he asked is that people are not aware about the fine print. It's a more like 30,000 high policy statement. So as we know that private sector has also been, besides these states, private sector have also been asked that if they want to import, they can get it. There are some provisos which are not very, difficult and not with full bill. But the fact is that globally vaccine availability is restricted. Sputnik is likely to come over this week or so, but how many doses we will get, I nobody probably knows exactly because it will be imported, and the next round of local manufacturing is going to start somewhere in the middle of May. So the key bottleneck of universal immunization is availability of vaccine. Now, your next question is very important, and you have asked two questions. One is about herd immunity, and the second is availability of the vaccine for everybody. So I'll take up vaccine for availability for everybody. And I think that before July or so, adequate availability for younger population will be a challenge. Unless somebody finds, or somebody like Sputnik, which has been cleared by DCGI, decides to give some 10 or 20, 100 or 150 million doses, it is only in that case that the vaccination drive for younger people can continue at a rapid pace. But the important point which is doing rounds, but I think we need to understand a little more about this herd immunity. Herd immunity is really a notion at the moment. So even in places like Israel, where they have immunized 60, 70, 80% of people, and now they are saying that they are moving ahead, but they are very closely monitoring for how long the transmission issue can be taken care of, because we don't know about how effective. But it is very clear that RNA vaccines are better in preventing transmission of virus from one individual to another as compared to the vaccines we have available in our country, that is Covishield and Covaxin, and maybe Sputnik also. They are not as efficient in transmitting. And unless the transmission dynamics is influenced significantly, the so-called herd immunity remains elusive. So at the time, I think immunizing as many people as possible is a key issue. But this has to be seen in the context of vaccine availability, and which I think the supply situation is likely to ease out only after 8 or 10 weeks. I'll stop at that.
You know, Dr. Arora, if I heard you correctly, you said the younger population, that's 18 to 44, can expect a sufficient supply only from July. Is that right? Is that what you said?
Yes, that's what my personal sense is, because the vaccine availability will improve around that time.
Okay. Okay, so we have started from 1st of May, but it's very unlikely that most people will get the vaccine by July. You also made an important point, which I want to take to Dr. Raghuvanshi, that on paper, private companies and state governments are allowed to get vaccines from anywhere in the world, subject to the condition that they have been cleared by FDA, EMA, and a few named agencies. Has there been any luck with that, Dr. Raghuvanshi? What has been your experience? Are there any vaccines out there that can be sold to us?
No, we have not specifically engaged about the import of vaccines, direct import of vaccines, because that requires a certain scale. And I think it will not be possible for individual organizations to do that. And that can be done only on a collective platform. And I think government is best placed to facilitate that, at least, if not participate in that.
Yeah. Dr. Raghuvanshi, in your view, how can the whole process be sped up more evenly? Is it time to also allow healthcare providers like yourselves to go out there and vaccinate people, whether it's at companies, whether it's at housing societies, to give you that bandwidth to go and find people who want the vaccine and, inoculate a wider range of people rather than this current process, which seems to be creating more bottlenecks?
No, I think those kind of restrictions have already been removed. It is very much feasible to go and vaccinate people either in large corporates or large condominiums, etc. So that part has been taken care of. The biggest challenge is supply. We don't have a challenge in inoculations to be done. We have challenge in procuring the vaccine. So as long as that part is not resolved, the delivery of the vaccine is not going to be smooth. I think as far as the community outreach kind of vaccination programs are concerned, I think those bottlenecks have been removed. Even for people above 45 in limited way, many places had allowed to do it in condominiums, etc. In Haryana, for instance, it was allowed, and we did several camps in large condominiums to vaccinate people who were above 45. Of course, these people were all registered through the COVID app, etc. So I think that part is not a challenge. The challenge is one and only, which is the supply, and then not a predictable supply. So as long as there is a clear visibility that I'm going to have X doses of vaccine available, I have takers for that, and I have people who can deliver it. So I think that is why it is important that this is centralized in some way or the other, where there is a complete visibility as to when the vaccine is going to be available and in what quantity, so that the delivery can be organized by either public sector or private sector, or this is not a very difficult thing. So I think the supply chain is what is important part, and unless that is resolved, the process is going to be slow.
The process is going to be slow. Hopefully, it will pick up speed. I'm out of time, but so many more questions. Another important one, for example, is that do state governments also need to prioritize who gets the vaccines between the 18 to 44 range, because it is in short supply? Should those who are immunocompromised, those with comorbidities, have the option to go first? Is it going to be an open market? Would that be fair when really supply is in such a bind right now? But we have started so far. At least that is one good thing to hang upon, that the vaccine process has started for 18 plus. When will your turn come? Well, you'll have to keep watching that CoWIN portal like a hawk and hope that you get a booking. Thank you so much to all of you for joining us on this special broadcast today.